Did you know that most people are diagnosed with hypothyroidism during the winter months? In this episode of Thyroid Thursday, I'm going to tell you why TSH normally rises during the winter and why you shouldn't be overly concerned and why most of you don't require thyroid medication. So in this episode of Thyroid Thursday, we're talking about the winter shift of TSH. And we know based on lots of clinical studies that there is a normal shift or change in thyroid values during the winter months. We may see a TSH rise as much as 14 or 15 or 20%. We may see a free T4 drop on average about 5 or 6%. We may see a rise in free T3 somewhere between 4 and 5%, okay? And this isn't broken physiology. Whether you feel tired or fatigued or not, this may just be the normal adaptive change, and I'll explain why in a second. But why does this matter? Why would we be concerned about it? Because if you're working with a functional or integrative practitioner who's saying that TSH needs to be between 1 and 2, and you have a normal rise in TSH due to it being winter of 14 to 15%, that may easily push you out of that 1 to 2 range and cause that clinician to think they need to prescribe medication. If you are somebody who's seeing a traditional medical doctor or endocrinologist and you have a TSH that hovers around 3.5, 4, and you have a 15% swing in your TSH because of the cold and darkness of winter, that too may push you out of their lab reference range and into a range where they think they may need to medicate you. And that medication being provided may be totally inappropriate. So why does this happen? One, cold exposure, okay, increases TRH. That's a hypothalamic hormone. And then the TRH, because that's elevated, it goes to the pituitary gland and stimulates TSH, thyroid stimulating hormone, and that's going to drive increased thyroid hormone production, okay? The other thing that happens with cold exposure, you're going to get increased deiodinase 2 activity, and this is the primary hormone that converts T4 to T3. And this increases that conversion T4 to T3, so we should have increased circulating T3. So cold is supposed to stimulate the body to increase the metabolism, to increase heat so we feel and function better. The other thing that can happen during the winter is we have more time in darkness. And when we have increased time in darkness, we have increased melatonin production in the pineal gland. And when we have increased melatonin production, that stimulates the hypothalamus to produce more TRH. And we have more TRH, we have more TSH, we have more thyroid hormone production, and we have more T3. So both cold exposure and increased darkness can cause an increase of TSH and an overall increase of T3, which usually makes us feel better. Now, why is this important? Again, 15% swing may cause somebody to be diagnosed with hypothyroidism when they truly don't have a glandular problem that requires more thyroid hormone. So what we often see is people who've never been diagnosed with hypothyroidism, they go into their physician in the winter for a normal checkup. They get their thyroid panel run, their TSH is a little high. The doctor says, yeah, you feel a little tired, you feel a little fatigued, and it's the winter season, and their diet's off a little bit, and they're not sleeping as well, and maybe they're drinking more alcohol. And yeah, maybe I'm a little tired, fatigued, maybe I've gained a few pounds over the winter, and they get put on thyroid medication that they didn't need. And that can do two things. It can work against the normal adaptive physiology, suppressing the body's ability to raise TSH, to increase production, actually suppress the body's ability to regulate itself, and create a glandular condition where they're actually suppressing the gland from making thyroid hormone. And two, that added thyroid hormone may contribute to reduced conversion of T4 to T3 in some tissues, causing more hypothyroid symptoms, and it might increase the amount of T4 and T3 saturating hypothalamus and pituitary and create more hyperthyroid symptoms. So not really what we want. So there's many people that get diagnosed with hypothyroidism with mildly elevated TSH levels get put on medication and then never feel well or can never find the right dose. And the primary thing that drove their thyroid gland condition in many cases was the medication that they were prescribed inappropriately. In many cases, when we're prescribed thyroid medication, when it's not needed, when the mild elevation of TSH we see is an appropriate adaptation to cold or darkness, we can work against the adaptive physiology. We may cause the glandular suppression. We may reduce the decrease the circulating T3 in circulation and in the tissues, and may cause hyper and hypothyroid symptoms. So we got to be really careful. We have to be aware that thyroid values change seasonally, especially TSH, because that's the biggest lab that's used to determine whether somebody needs thyroid medication or not. But TSH can fluctuate. 15% could definitely push you out of somebody's optimal or lab reference range and cause you to be put on thyroid medication inappropriately. So what can you do? If you get diagnosed with hypothyroidism in the winter months, before you get put on medication, get a comprehensive thyroid panel done. TSH, not just TSH, not just TSH and free T4, not just TSH and free T4 and free T3. You want TSH, total T4, total T3, free T4, free T3, T3 uptake, thyroid antibodies. Get the full panel done and get it interpreted by somebody like me who interprets the lab and focuses to help somebody recover the thyroid physiology, just not try and manipulate a number. Okay, so do that first. If it's truly elevated TSH with lab low T4 and free T3, you may need some thyroid medication. If it's a slightly elevated TSH, but T4 and free T4 are still within the normal range, or they're a little bit towards the lower end of the range, but you have plenty of T3 and free T3, you likely don't need thyroid medication. If you're one of those people who goes into your doctor's office during the winter months, you actually feel pretty good, you're not having lots of hypothyroid signs and symptoms, and your doctor says your TSH is slightly elevated, looks like you put on a little bit of weight, and you said you're a little tired at times, what could you do? I would wait and recheck those labs again in 8 or 12 weeks once we're moving out of the colder, darker months. You may find that, hey, that TSH is now normal, T4 is normal, T3 is normal, and I feel the same as I did before. We don't want to induce thyroid medication too early if we don't have to. Because it can create more problems with conversion of T4 to T3, and it could actually start to induce a more hypothyroid state. The medication inappropriately prescribed could actually be the primary cause of hypothyroidism later on in life. And then 3, if you're a person who gets diagnosed, hey, we think your TSH is a little bit high, you're a little tired, you're a little fatigued, it looks like you're gaining a little bit of weight, we're gonna put you on medication. Before you do that, you should consider what I call the lifestyle factors. Are you getting appropriate levels of sleep every night? 7 to 8 hours of uninterrupted sleep? Do you have a pretty healthy whole food based diet? Are you exercising every day? Are you managing the life stress, financial, relationships, work? Are you taking time to, downtime to rest, to recover? Are you limiting the amount of more toxic foods and alcohol you're putting into the systems? Are you working on improving your daily habits and behaviors, or are you really, a lot of your problems, a lot of things that may be creating the stress in your life is your habits, your diet, and your behaviors? If it's those things, before you just throw medication in there, improve your diet, improve your habits, improve your behaviors, improve your lifestyle and your relationships, and you may find that you start to feel and function better, and you don't need the thyroid medication. Because if you just add the thyroid medication and it don't address the real things that are causing you to have poor conversion or true hypothyroidism, that medication is only going to work temporarily at best. Anyway, this is the end of today's Thyroid Thursday. I want to wrap this up by saying you should expect a mild rise in TSH during the cold winter months, and that in many cases is not a sign of dysfunction, but of natural, appropriate adaptation. All right, hope this helps.